One. Hi, everyone, and welcome to I Am Health is Wealth with our host, Dr. Dalal Akoury. Dr. Dalal, thanks for again being able to take the time for your listeners and viewers to learn more and more about wealth and health. So the two different subjects we think about most in our New Year's resolutions.
Yes! 2023 is going to be the best year ever for each and every one of us. So it's really health is wealth. It's really not health and wealth. Health is really wealth. Without my health, I can't be productive. I can't be Dr. Akoury, who's able to help so many people. I cannot make money. I cannot take care of my grandbabies. So really, health is true wealth. A lot of times we think that health is, okay, something by the sideways. No, health is really the true wealth. And we know that from the COVID era. During COVID, everything stopped. Everything stalled. No businesses, no money, no nothing. So really, your health is your biggest investment ever. If I'm dead, I can't be speaking. If I'm dead, I can't be helping patients. During the time I was in the hospital, it was a heart attack, a heart issue, and mitral valve surgery. I was no good for no one. So without my health, I'm nothing. So I want to help people to really appreciate the health and not to take it for granted. We appreciate our car, we appreciate our homes, we appreciate our trips, but we should first appreciate our wealth, well-being, because that's the true wealth. So that's my mission.
It's truly a mission, and it's exciting. And we're on our topic today is weight loss, because isn't that one thing when we talk about health goals for 2023 is to lose weight, right, Dr. Akoury?
It's really not about losing anything. It's we gain everything when we optimize our weight. So it's not about losing weight. It's about gaining health. So really, if you take this as gaining health and not losing anything, you're going to be a whole lot better thinking. So it's about gaining pride, it's gaining beauty, it's gaining power, it's gaining energy, it's gaining everything. So you lose nothing. You're not losing anything. You're gaining everything.
All
so
right.
for me, it's not weight loss, it's gain everything.
All right. So as I'll keep bringing up the name weight loss, even though it's not for you. Weight loss is a tricky subject. Is there something, should this be something that comes easily to drop the pounds or decrease our, go down sizes?
I like the word downsizing. We really are optimizing the beauty, the shape, okay? So sometimes you may think you're not losing weight, but you're actually gaining muscles, because fat weight versus muscle weight, they're different. Fat weighs a whole lot less than actual muscle weight. So sometimes you could be on the right track, but you seem you're not on the right track. So gaining muscles is part of what we call losing weight. So don't be discouraged if you're not seeing anything on the scale that is encouraging at times. Was that a good answer?
Yeah, that's great, but the scale can be a scary place, especially if you're trying to use that as your measuring stick, for sure.
Well, if you understand how to measure properly, what weighs more? Lots of pennies, tons of pennies, $100 in pennies, or $100 in a bill? The scale means absolutely nothing. It's irrelevant. Am I building muscles and shrinking the fat and making myself optimizing my weight and my looks and how I feel? That's more important to me.
Absolutely. So The challenge for weight loss is just to get started. What are the first steps for losing weight?
There's a lot of steps, but let me start with one thing. Approaching people who have weight issue can be a very delicate subject. So when you approach someone who has a weight issue, instead of saying, lose fat and you look ugly, and I recommend this to you, there's a better way to say that. Hey, listen, I respect you. And, health is wealth, like I just said. And, optimizing your weight to make you feel good and look good may be an option. Would you want me to discuss this? So I talk to the patient and introduce the subject to the person or the subject in a gentle, respectful, non-judgmental way. You say, oh, you gained too much weight because you're eating too much. You're eating junk food. But how about you say a different way? Hey, listen, your health is your wealth. You're being overweight maybe because of some other reasons. Maybe your hormones are off. Maybe it's diabetes. Maybe it's the stress level that causes your cortisol to be off. So just the way to get people to think about weight is very important. So respectfully, to say it without any judgment, you just discuss the risk factors of being a little bit on the overweight side and include them in the partnership of the weight loss or the optimization of health or the gain of energy. And let's use less negative words.
And that's, again, the thing we talked about, the negativity of the scale for losing weight. And it sounds like you've answered this question before about the scale not being the measure. Do people focus too much on that scale?
It's because we want something that we think is objective, something that we touch with our hand. So a measurement is sometimes you measure weight and you think that's a really, it's a way to measure something is a scale. So you say, okay, have I lost weight or have I gained weight? Sometimes it could be clothes. It could be what you ate. It could be too much water. It could be lack of sleep. It could be a whole lot of things that are entering in the factor of the scale. So weighing religiously on a daily basis is dangerous. You need to really understand that by changing lifestyles, you are gaining muscles while you're losing fat. So you may conceivably, you may have the same weight, but you're slimming down. So your clothes would be a better way to judge.
Mm-hmm.
Your figure would be a better way to judge. Your demeanor would be a better way to judge. Your feeling good would be a better way to judge.
So what is the best?
I answered your question.
You definitely answered that question well. What is the best way to lose weight?
The best way to lose weight really is to make a decision. Is number one, you need to understand that it's a complex disease, okay? If you don't see that you are having weight issue, I can't make you think that way. You got to really realize that you have a weight issue. And then there is hope. If you don't have hope to lose weight, then you just don't try. So the first thing it's like in AA meetings, right? First thing is to recognize there is a problem. And then you have control issue with that problem. You have to accept the fact that first of all, accept I am a little bit overweight. Okay. And instead of saying, I'm fat, I'm obese, using negative words, it's not going to help you. Right? It's just say, okay, I'm overweight. And what can I do to gain muscles and lose fat? Okay. So first thing if you do is you start thinking lifestyle with a positive attitude. And, whoever you work with, meet is the people, if you meeting people who eat, people who negative, then first of all is move away from the environment that causes you to overeat or under metabolize, whatever. Just recognize that if you remove yourself from that environment is the first step. So step one is to recognize there is a problem. Step two is to remove yourself from the temptations people, from the temptation environment. Third thing is to start loving yourself the way you are, okay? Not because I'm overweight, I'm horrible, I'm ugly, I'm this or that. Love me and see what can I do. First of all, drink more water. Sometimes you think you're hungry when you really are thirsty. So remember, hunger and thirst act similarly. So if you feel hungry, drink water first. Now, the other thing that is really important is to start moving. Just moving. If you're sitting on the couch every single minute of your life, well, say, I'm going to go from here to the toilet, from here to and tomorrow you go to the kitchen. And the day after, you step outside the door and walk around the house. And then the day after, just small steps and small wins. You got to have small wins. You don't have to be happy with the small wins. They're really exciting. Exciting is so important. Then learn that, as I said, hydration, sleep. If you don't sleep enough, you will not lose weight. You got to sleep to lose weight. So to gain muscle, lose fat, you got to sleep. Z, make you lose weight. This de-stress, work under stress. Then those are first steps. Then get into the habit of doing things over and over, eating better. Stop one thing at a time. Stop processed food. For 1 week, don't eat any processed food. The next week, add no sugars. The third week, don't really make it a chore so you hate it. It's a journey. It's not a chore. Was I answering questions?
All right. So far, great stuff. What happens when I plateau and stop losing weight? A lot of people get to a certain spot and they plateau and they have not reached their goals. They've not gotten down to the size they want. They've not gotten to the shape they want, and they feel like it's just things are not moving well.
That is a great question. When you get to a plateau, you need to sometimes know that this is normal. Start with saying, that's normal. I plateau, normal. Then what do I need to do the next step? Do I need to do a genetic testing and check my nutrigenomics and see if I lack some B vitamins, special vitamins that would help me reduce my weight, help me reduce my blood sugar, help me reduce this? Do I have the issue with that? Then I can check my thyroid. See, do I really have a thyroid problem? Now that I slimmed down enough, everything looks beautiful. Is it sometimes you have to just give it a chance? Just stop the diet. I don't like the word diet anyway. It's a very bad thing. I like to say lifestyle change because I don't die. I don't diet. I live better, healthier. I just start eating more water, drinking more water, getting more vegetables, raw food. All that great stuff would be a wonderful thing to do. So I hope that was a great answer.
Yeah, so you basically have to go and continue to step it up a little bit more once you get that plateau, it sounds like, and just, keep on going. Here's another one that's really, really interesting question I have for you.
Just
You don't like the word, go ahead.
No, just a second about plateau. Sometimes plateau is normal. I just want to make sure I understand plateau is normal. It means you need to take a break from the worries about the weight, the worries about all this, okay? You just have to make a break. If you are doing everything right, continuously the same, nothing happens. You're gonna have to recycle. You have to restart a new cycle of something. So you gotta do something different, okay? So you need to either exercise more, or sleep more, or adjust something different, or change something. You got to have something change. Just look for other reasons why things are stopping. Check your hormones. Just ask your doctor, is my thyroid off? Why am I stopping losing weight? Is my metabolism changing? Do I have hormonal imbalances now? Did I put more stress on myself? What happened? Root cause, deep dive.
Absolutely. Such great stuff. Now, are there healthy ways to diet? So I guess the question is, there's a lot of unhealthy ways to diet. How can we make sure that they're healthy? Because, people will try shortcuts. They will do the next gimmick diet or lifestyle change, as you like to call it. But are there healthy ways to do this? And you kind of given us some good tips so far, but anything more to give towards or to caution against when people say, hey, I want to make this lifestyle change, and it's not really the healthiest thing to do?
Do your homework. Food is medicine. You need to understand what you're eating. Are you eating farm to table? Are you eating food that is real food? It's funny when you eat a sandwich and say, this is real cheese. So are we eating wrong cheese? You need to understand, if you're eating toxins, you're going to accumulate fat. So the more toxins you're eating, the more fat you're going to have. So you're going to really make sure that when you are, and don't do diet, because diet, you'll break it. It's like rules are made to break. So if you want rules are made for us to break them. If I'm making a diet, it's a chore. This is a chore for Dalal Akoury. I don't want a chore. I want to be able to enjoy that journey. So eat with mindfulness. Mindful eating is not overeating. Mindful eating will help you lose weight. What do you mean by this? If I'm out eating while watching TV, I don't even know what I'm eating. When I'm eating mindfully, I help and prepare all my enzymes. Everything is working beautifully. I smell the aroma of the food, and it really changes and triggers things. So I have aroma going on for me. I have taste going on for me. So it's a pleasure. I just smell it. I pleasure it. I just chew it. I just enjoy that mastication. The chewing in itself makes you oxytocin in your body. That oxytocin gives you energy and joy and happiness. Eating. You don't even know what you're doing when you're watching TV. So getting TV dinners is not okay. That's not mindfulness. Then when you're almost ready to feel satisfied, you need to stop eating just before your hunger goes away. You have to start moving out of the table a tiny bit hungrier, okay? Then you need to learn to sleep. It's very important. If you don't sleep, trust me, you will never lose weight. You will not lose weight.
What is not sleep?
What is
the proper number of hours sleep? Restful sleep.
I would say most people between 6 to 8. I would recommend 8, but at least 6 hours of sleep. So that's really, really, really very important to do. So don't read, Dr. Google is not really a doctor. There's controversy on every single diet you read on Dr. Google. You make choices that are based on you and your research, or work with a doctor like us, who is functional medicine, a doctor who understands integrative medicine, a doctor who makes you eat food that is similar to you. Eat in season. Ketogenic diet, what does it do? Okay, I never do total ketogenic diet. Like you said, everything plateaus after a certain time. So even if you're doing ketogenic diet and you lost a lot of weight, after that you plateau, you're going to do something different. You're going to change. And I don't like keto all the way because it destroys your kidneys. So your kidneys are so important. So you want to make sure that you're not totally destroying your kidney. So use a modified keto. What is keto means? Keto means you're not eating food that has a lot of sugar, but you don't have to be totally ketogenic and acidic with the ketosis that is happening. You don't need that. Okay. So paleo diet, which is how our grandparents and ancestors ate, that's more natural. You need to eat for your genes. That's how to lose weight. You need to give rest to your gut and your everything. And how do you do that? Very simple. What we call intermittent fasting. Most religions have fasting. Why do you think? It helps you detox. It helps the gut to rest. When the gut rests, guts repair. So you repair your gut during that intermittent fasting time. It's not, oh, okay, it has to be 12 hours. It has to be 16 hours. Just nothing is rigid. You need to learn your body.
Exactly.
You need to really make right judgment. Don't believe everyone who just goes on Google or
Exactly. Yeah.
or Twitter or TikTok and say lose weight or anything.
They have a
Every
special
one of us is
method, and it's
individualized.
not always true. What do you think the mistakes people make when they try to lose weight?
But when you try to lose weight, you're trying too fast and you're getting stressed. Okay, stress causes weight gain. So if you are going to take the journey as a stressor, you're going to gain weight. This is a journey of joy. Start drinking water, 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 water. It's not water fast. I never said water fast. Drink enough water, you're not going to be hungry. Okay. I never said water fast is good or bad. Okay. There is time where water fast is good. There's time where water fast is bad. So you need to really do what's best for your body. Sometimes you need someone like me to be able to evaluate that. You know, sometimes we do some testing to help us see where the problem is. If you're too inflamed, you're going to gain weight. If you have too much toxins, you're going to gain weight. If your hormones are off, you're going to gain weight. If you're diabetic, you're going to gain weight or lose weight. So really, it's deep dive. I hope I helped.
No, definitely you have. And then there's what is a healthy weight for a person? Should we look at BMI?
Lots of controversy about BMI. You know, what we need to look at is muscle, evaluating muscle mass, helping to know more about the muscle mass, fat mass, the other things that really just eat healthy for your diet, for your type. Eat healthy for your ancestry. You know, I'm Mediterranean. Mediterranean food would be helpful for me because my genes are made to interact beautifully with that diet. People from Alaska, their genes, the genes for digestion are tailored to handle fatty food. So you really need to understand that eating for your genetic makeup in itself is a first way to help you. Don't eat when you're stressed. Don't eat when you're hungry, when you're angry. Don't eat when you're hungry. Eat before you get hungry. Okay, because when you're hungry, you're gonna eat. No, eat when you're not hungry. Prepare your own meal so that you get your enzymes turned on. You know, your saliva gets on. Your gastric juice gets on. You know, there's things you could do to really help you with the weight loss journey. It's a journey, and celebrate small wins. Celebrate small wins.
And that's it. Celebrate those wins for sure. This is the kind of question we hear from everyone saying, I just can't lose weight. I try everything. Should you just give up, or you just keep trying different things till you finally figure it out?
Okay. When you are at that level, that means you may have a disease that needs a professional to understand. You may need testing. You may need help. If you've been on too many yo-yo diets, lose, gain, lose, gain. You start losing. I was here and I lost this much. The next time I was here, but I lose this much. And then I go here and I lose this much. So that yo-yo diet is like an elastic that stops working together with you. Okay. So what you need to know, am I having hormonal imbalances? Do I have a genetic defect that needs to be addressed? Am I having stress and my cortisol is up? Am I diabetic? Is my insulin too high? Do I have a history of high blood pressure? Do I not sleep well? Why am I gaining weight? Am I constipated? Am I loaded with toxins? Am I eating food that is not real and that makes you hungry? Those are very important things.
Right. And I think what we've learned is specifically enough if you talk to a regular doctor versus a functional medicine doctor like yourself, Dr. Akoury, the issue that you're going to have is they're going to just put you on a medication. They're going to put you on different medications. They're going to try different things. They're not going to come back to traditionally what's healthy to get you well. And that's sad, but true.
Traditional doctors do what they know to do. So I can't blame anyone. I was one of those Western medicine trained allopathic medical doctor. I thought calorie in is actually calorie out, but it's way more complex. It has to do with your microbiome. It has to do with your nutrigenomics. It has to do with your stress level. It has to do with your hormone level. It's way more complex than just a medication. And if we're not going to stop that situation of that quick fix, we will never, ever be healthy. There's no quick fixes.
Now, there can't be a quick fix. Come on now. It's got to be easy, right? Nothing's easy in life. To make money, it's not easy. To lose weight, it's not easy. To be healthy, it's not easy. To do anything that causes work, which is sometimes is a hard thing for people to do, we run into these things. So now what we're going to go really quick. I want this to be another topic on the podcast is intermittent fasting, but I'm just going to ask your thoughts. You kind of brought it up a little bit before I asked this question. What are your thoughts on intermittent fasting?
I love intermittent fasting if I don't like anything that causes stress. If you're doing intermittent fasting with progression, slowly increasing to what you need to, when you're not detoxing too fast, when you know what you're doing, I think it's incredibly great. If you don't know what you're doing, you're going to get yourself drowning. You got to have someone who can coach you through this. And it's not just anyone, someone who has been there, someone who understands the language of weight management, or someone who does functional or integrative medicine. There's a lot of people out there who are claiming things that they can't do, and it's really as sad as it can be. You deserve better. Invest in you. You're very special, and I know you will find the answer, and I know that I am going to be here to speak up as loud as I can so you feel great, look great, and live the best life ever.
And what you're able to do is look at this perspective in a holistic point of view, not just like one way of doing it, looking at the holistic person and kind of tailor a program for each individual. So where can people find information on you, Dr. Akoury?
My clinic is Aware Med Health and Wellness Resource Center. They can Google me. They also can come to my TikToks, which I'm going to be working very hard on TikTok to teach you and help you. And so TikTok, my handle is Dr. Dalal Akoury. and WebMed Clinic and Dr. Dalal Akoury, MD, are websites. And my phone number is 843-957-1196.
All right. That was a great podcast, guys. Take care, everybody.